we're fortunate to have with us today Dina Rimashevsky from Grace. Dina is a clinical educator, and I'm really looking forward to this. I'm talking with a couple of people here at RSVP, and they're wondering about exactly what's involved in making these kind of decisions. So, Dina, if you'd go ahead and take it away here. Thank you for doing this for us.
Thank you for having me. Yes, as Mike said, my name is Dina. I am a clinical educator from a Grace Hospice, and my background is in social work. So I've been a social worker for 13 years, 14 years, and I've predominantly worked with those with physical disabilities and chronic illness, as well as those particularly on hospice. I've been in my current role for about 6 years, and one of the things that I enjoy doing is going out into the community, answering questions that people have related to advanced directives. I think that it's a really important topic. I'm also relatively casual. I know it's a little bit hard to be super informal on virtually, but if you have questions, feel free to either drop them in the chat. I have the chat open and I'm watching it, or just speak up. That will work as well. As I get started, I want to just make sure that we have the same understanding about some terms. So I'm going to start with a list of definitions. These are definitions and how I will be using them throughout today's presentation. So advanced care planning, according to the National Hospice and Palliative Care Organization, and this definition matches that of the American Bar Association as well, and other legal sources and Wisconsin-based sources as well. So advanced care planning is making decisions about your healthcare that you would want to receive if you're facing a medical emergency. Advanced directives are legal documents that detail your wishes. If you are unable to make decisions for yourself, principal, when I say that someone is a principal or I describe a principal as doing a thing, I am referring to the person that created the advanced directive. And the surrogate decision-maker, this is the agent or person who has been entrusted by the principal to make decisions on the principal's behalf. So occasionally, in these conversations, legalese will and legal terms will end up being used. And so again, if there's any questions, if I say something, you're like, I don't know what that acronym means, Dina. I've tried to catch myself, but occasionally I do drop into jargon speak, and I apologize in advance, and I encourage you to call me out on it if you hear me do it. I'm working on it. So I'm going to start with a real basic question, and that's, who should complete their advanced directives? At what point in your life should an advanced directive be completed? Does anyone know? Or what would you assume? You can use the chat or you can speak up.
Everyone.
Thinking everybody, right? Go ahead, Lisa.
Everyone. Mm-hmm. Yeah, and is there a particular age? Yes, Angie put in the chat. As soon as you are of legal age. Absolutely, yeah. This is something that we recommend for everyone, regardless of their age, if they're over the age of 18. Health status isn't part of it. How much exercise you get isn't part of it. None of that should deter us from making these decisions and having these conversations. And yet, while, excuse me, we all agree, and it largely matches what the Kaiser Family Foundation found in 2017, that 97% of people say that it's really important to put their wishes in writing. Under half of those that were surveyed have actually done it. And this is from people who have chronic illness. This was a chronic illness, people living with chronic illness survey. So 97% of the people believed it was really important to put their wishes in writing, to have conversations around advanced care planning, but only 37% had actually done it. And I see this in my work all the time. Everyone will say, yes, it's really important. This is incredibly important to do. And yet, there is hesitancy to actually taking the time and putting your words on the paper and having those conversations. And part of that is because these are hard conversations, and it's hard to think about. And it's also hard to think through every possible scenario. A lot of people will get caught up on the every possible scenario sort of idea, that they have to be able to consider everything. And I'm here today, if that is one of the areas that you're like struggling with, to tell you that that is an unrealistic expectation for any document to have. But there are ways of thinking about it that can enhance the powers and understanding that your family, loved ones, agents, advanced, the surrogate decision makers have when they may be put in that position. And I will do that through a series of reflection questions that I will encourage you to consider, or encourage you to talk about with those that you care about. Whether you are here today because you're like, oh, I need to create an advanced directive, I need to review my advanced directive, and I want to know what to consider, or if you're here because you are supporting someone else who needs an advanced directive and you're wondering how to broach that conversation. I'm going to provide to you some questions that can be helpful, either for your personal consideration or in having conversations with others. So to start with, here are some reflection questions.
I just emailed you my link. It's a live link.
Is everything okay?
Looks okay here.
All right, perfect. So some of the questions that I encourage people to consider as they are starting the process of either writing or reviewing their advanced directives is really thinking about what makes my life meaningful. What is it? The people that are in my life, are there activities that I'm doing that I want to continue to do? What are the things that I most value? And these aren't necessarily questions that you're going to have to write into your advanced directives. What this is rather is a way of considering and of identifying for yourself, what do I need my family and my loved ones, those that may have to make a decision for me in the future, what do I need them to know about me? What do I need my providers to know about me? And I will use my self as an example, throw back the curtain a little bit, as it were, and share that I'm 37 years old, and I live with a couple of chronic pain syndromes. I have chronic headache issues, and I have arthritis in a hip from hip surgery I had to have when I was 25. And this leads me to, I like to joke around and say that I'm a walking barometric pressure sensor, because anytime there's a change in weather, either my hip will hurt or my head will hurt. But because of that, I live with a certain amount of pain on a day-to-day basis. So while for some people that I know, and some of my friends, because of where they are in their life, their expectation is that they wouldn't, on a day-to-day basis, they wouldn't have any pain. I don't have that expectation. What's more important to me when I think about pain management, because that is an issue that I deal with, is not so much that I don't have any pain, but that can I still enjoy my life even if I'm having pain. And one of the measures that I have for that is, can I engage in a meaningful conversation with those that I care about at the pain level that I'm at? And my goal is that every day I'm able to do that. And any day that I'm not, that's when I will look for pain interventions. But I'm not necessarily going to take pain medication every time my hip starts to hurt, because I would constantly be taking Tylenol, and it would destroy my stomach. And I just don't want to do that. So that is what I consider. Now, that is one part of my story and one part of my consideration when I've had these conversations with my loved ones. Please don't, for me, I don't need to have zero pain. For me, I need to be able to have meaningful conversations. That's what's most important to me. For some people, what cultural, religious, spiritual beliefs are really important to you. And this is also, it's important to know if your agent is going to has conflicting beliefs from you. And I'll talk a little bit more about this when I talk about choosing an agent, but it is important to understand where your beliefs are, as well as the beliefs of the people that could potentially be making decisions for you. And can they set their beliefs aside to honor yours? And that can be a really important and a really big deal. The forms that we use in the state of Wisconsin largely to help us make these decisions are the power of attorney for healthcare and the living will. Historically, the living will was the first advanced directive that we created nationally, and it was done in response to situations where people were ending up in the emergency room or ending up in the hospital with nothing to say what their wishes were, and here they are in a real medical emergency. Maybe they were in an accident, maybe they have had a stroke and they're no longer communicative, but for whatever reason, they're not able to share their wishes in a meaningful way with their care team. So the living will was the first kind of layer of advanced directives that our country had. And it's a legal document that's where the principal can say, these are my preferences for life-sustaining treatment. This is what I want you to do. This is, I want you to give me a feeding tube, or I want you to withdraw a feeding tube. I want CPR, or I don't want CPR. Those sort of decisions can be detailed within the living will. The living will, however, is really strict in its focus. It focuses really on those emergent or urgent health situations. Generally, we're talking about anytime you might be hospitalized, maybe you've gone into surgery, that sort of thing, where the living will would go into effect. It doesn't go into effect in day-to-day situations. And so that's where the power of attorney for healthcare, that's when the power of attorney for healthcare was created, recognizing that not every emergent or every decision that may need to be made is going to, where there's not someone to make that decision on our behalf, is going to happen at the time of a crisis, a medical crisis. Sometimes we may get to a point where we're not able to make decisions for ourselves because of a natural disease process, or a natural disease process. And so a legal document was created to say, here's someone that can make the decision for me. They know who I am, they know what my wishes are, and they are able to make this decision for me. And so it's less about saying, these are the decisions that I want, and more about saying, this is who I trust to make decisions for me. The way that the state of Wisconsin forms are set up, there are some areas, so there's 3 different areas that you are able to either give a specific power to your agent to make those decisions on your behalf, or say, no, my agent can't make those decisions on my behalf. And those 3 areas are care for pregnant women, withdrawing or withholding a feeding tube and placement in a skilled nursing facility or a what's called a community-based residential facility. And so that is a higher level of care assisted living facility. So not quite as intensive care as you might receive in a skilled nursing facility, but you would still receive 24/7 care in a community-based residential facility. In the state of Wisconsin, an agent has to be given the ability through an advanced directive or through the power of attorney for healthcare. The surrogate decision maker has to be expressly given the permission to make decisions in those areas. With the power of attorney, if someone has a power of attorney in place and it says within the power of attorney that your agent can make decisions about withholding or withdrawing a feeding tube, but your living will says that you don't want a feeding tube, the power of attorney is going to take precedence. So that means that even though you may have said in a living will that you don't want a feeding tube, if you've given that power to a surrogate decision maker, they will follow what's in the power of attorney for healthcare. So anytime there's a disagreement between these two types of legal forms, the power of attorney for healthcare is given authority over the living will. And so I'm going to stop right here because I've just shared quite a bit of legal medical information, and sometimes people have questions here. So I'll give a couple of moments if you want to either type them up or speak them out.
I have a question. Is it possible to have more than one power of attorney? And pardon me if you've already answered that, but I didn't hear that.
No, I have not gotten to that question, and it's a really good one. So there are, in the state of Wisconsin, it is possible to have more than one power of attorney or a surrogate decision maker assigned. You can only ever have one power of attorney for healthcare document, but you can have more than one agent assigned through your legal document. And that's one of the next questions. So we'll get right to it. We'll get right to that. So when you are thinking about your agent and the what decisions they're able to do and the purpose of a power of attorney for healthcare document, and that's the document I'm going to focus on because it is the more legally persuasive document. The benefits of the power of attorney for healthcare is that you remain in control in the case of a sudden or unexpected event. If others need to make any decision for you, or if you're somehow unable to communicate your own wishes. It focuses on your values, which is why I encourage reflection questions. It provides peace of mind for yourself and for others. And nicely, it can be changed at any time. And it doesn't require a long legal process to go through. Understanding that these are the decisions or rights that a healthcare agent or surrogate decision maker would have. Making choices about your medical care, reviewing and releasing medical records, arranging for medical care and treatment. Potentially making decisions on living arrangements and deciding which healthcare providers can provide treatment. In the state of Wisconsin, a surrogate decision maker has to be over the age of 18 years of age or older, and they have to cognitively be able to make decisions. It cannot be someone who is either employed by a healthcare provider or facility of the person making the document, unless that they are also a relative of the principal. It cannot be your direct healthcare provider, so it can't be your doctor, it can't be your nurse, psychiatrist, nothing like that. And it cannot be a spouse of your provider or one of their employees.
I have another question here. It cannot be a healthcare provider unless it's someone in your family, did you say?
Yes.
Okay.
Mm-hmm. And it can it cannot be specifically, it cannot be your healthcare provider. So if you have your friend Joe and he happens to be a surgeon, but he's not your surgeon, he could be your agent. But if he were your surgeon, then he couldn't be your agent. So that's the important distinction there.
Okay, thank you.
Mm-hmm. And so then Jim had also asked the question of, can you have more than one agent? And the answer is yes, you can. However, it's not recommended to have more than one agent listed so there's different priority levels. The way that the documents are set up in the state of Wisconsin is they give you a space for the first person or people, and then they give you a space for the second person or people. Then legally, you can make a priority list of everyone in your life in an addendum. But in that first priority, you can say Joe and Susan Smith they're going to be my first decision makers. Now, generally, this will probably go okay if Joe and Susan are always in agreement and they're able to work together on making decisions. The problem will come in is if Joe and Susan are ever in disagreement and Joe wants to do one thing and Susan wants to do another. Legally, they have the same level of authority, which means that if they're in disagreement, it would have to go to a court in order for a decision to be made. And so since one of the purposes behind a power of attorney for healthcare, in addition to providing us peace of mind and making sure that our values are honored, is to keeping these decisions out of the hands of the courts. So I don't encourage there to be more than one person per line. You can do it though, legally. There is a really great tool when you're thinking about making decisions of who should be a decision maker for me, who should be my surrogate decision maker if I'm not able to make decisions for myself. This tool comes from the American Bar Association, and I've used this myself. And so I recommend it anytime I have a chance to talk about it. And you can, when you're thinking about who is going to be the best people or person to make decisions on my behalf, this gives you in line 1, you write one person's name. In the second line, you would write another person's name. And in the third line, you would write another. So I'm going to do this as if it were the way I had done it with my family for myself. So I have my first person, I have my husband, Dan. I'm just going to put a D because otherwise you all are going to watch me try to write with my mouse, and that's going to be messy. The second person is my little sister. I'm going to put a K. I'm going to change. There we go. So we have D, we have K. And then for the third person, I'm going to put my best friend, Jessie. So J. And as I was going through, I had to answer these 10 questions about them. So I'm not going to read them through. I'm just going to kind of do what I did. So we have, yep, they all meet first criteria. Yep, yes, this is not a problem. My husband and my best friend for number 3, absolutely, they would be able to separate and act on my wishes over their own. Yes and yes for number 4, but my little sister is further away. All 3 of them are number 5. 6 is the same for all of them. 7, yes, yes. Yeah, all right. So what it came down to were these 2 questions here. And now number 4 is less important in this day and age than it had previously been with the advent of computers and other technology making communication and connecting with people a lot easier. But my little sister does live in Nebraska, so it is something for me to be mindful of. Whereas my spouse lives with me and my best friend lives in Waukesha County, so they're closer. The one that was most important, though, was number 3. So my sister and I grew up in a church that I no longer attend, and the church puts a large pressure. That particular church, not pressure, but it largely values the sanctity of life and doing everything possible. And I had asked my little sister Chrissy if she would be able to make a decision to take me off life support. And she said, "Oh, Dina, I mean, I don't know. You know what we grew up with, and you know my belief systems." And I was like, "I do, and I respect you." And she's like, "And I respect you, but I just don't know if in an emergency, like if I were being completely honest, if I could do it." And I was like, "That is fair. It is a hard thing to ask someone to do, especially when it's their values that you're asking them to put aside." And I was like, "But this is an important value to me. I need someone who would be able to take me off life support. And for that reason, I'm not going to choose you as my agent." So this was a conversation that I had with her. I didn't surprise her with this. And for that reason, she's very understanding. I do have it listed that I want her to be consulted and involved in providing background on my family and my history. But when it comes to actually making the decisions, my medical decisions, my husband's my first agent, and my best friend's my second agent, because they met all of the other criteria. So some of these I have already covered. So these are the different elements that are pulled out in the Wisconsin Power of Attorney for Healthcare form. An important thing to note is that even if you don't use the Wisconsin Power of Healthcare form, the way that Wisconsin law is set up is if these elements are not called out, so if you go through a lawyer and these elements are not called out in your power of attorney for healthcare document, especially the first 3, oh goodness, I need to get rid of all of those. I'll just clear all my drawings. There we go. The first 3 elements on this list, if they're not called out in your power of attorney for healthcare document, whether it's through a lawyer or on the Wisconsin form, the assumption is that your agent doesn't have the ability to do it. So if you don't check a box, the way it's set up on the form for Wisconsin is you have a yes or no box. And if you leave it blank, you don't answer at all, it's assumed no. Your agent doesn't have the ability to do these 3 things. Similarly, if you go through a lawyer and the lawyer doesn't call out, or your document doesn't call out admission to a nursing home, withdrawing a feeding tube, those sorts of things, your agent doesn't have the ability to make those decisions on your behalf. So that is a Wisconsin state law, a specific thing. This is where I will sometimes get asked questions about out-of-state advanced directives, or if Wisconsin's advanced directives are recognized in other states. And in the way that our advanced directives work in other states is that it is recognized by all other states. Our advanced directives are set up to be very comprehensive, and they meet the guidelines, the minimum requirements of all other states that we interact with. Generally, we will accept power of attorney for healthcare documents from other states as well, through a process called reciprocity. However, because it is in this, even if it was made in a different state, where it was made, it doesn't matter where it was made. When it is in the state of Wisconsin, it has to call out these 3 things in order for your agent to have that power. In the state of Illinois, for example, it does not call out these 3 things. And so occasionally we will have issues with people coming up from Chicagoland. They have an advanced directive, and maybe they need to be admitted to a nursing home. They want to The goal that the family has is for them to be admitted to a nursing home here in Wisconsin. But if their power of attorney doesn't specifically say that they have the ability, that the agent has the ability to make that decision on their behalf, a Wisconsin nursing home wouldn't be able to accept them using the Illinois power of attorney document. So that's kind of one example that occasionally arises. For that reason, I highly encourage people, if you are moving from state to state, or if you are someone that travels quite regularly to one particular state over another, it is beneficial to at least consult with a local Aging and Disability Resource Center to confirm and have at least a basic understanding of what the advanced directive requirements are in the state that you are regularly in the states you are regularly in. When you are thinking about these three areas, sometimes people struggle with the idea of giving someone the power to place them in, for example, a nursing home. That's the one that comes up most frequently in my experience. The others are a little bit less concerning. These are some of the reflection questions I encourage people to consider. Medical treatments, are you just saying, I never want that, I don't want that at all, or I never want that at all? Where would you choose to be cared for at the end of life, and what would you be willing to give up in order to either live longer or to be to stay where you want to be in order to receive care? Another question that I will ask, especially for people on hospice, if they haven't really had a chance to complete their advanced directives, or it's been a hard question for them. I will ask about what is more important to you. Is it the quality of your life, or is it the quantity of time that you have left? Because sometimes we have the option of one over the other. And if you want both, and that's a reasonable request, right? I want both quality of life and I want a nice long life. Well, which is going to be more important? Because sometimes we will get to a point where we may have to choose one over the other. So is it more important that I have a longer life, or I live as long as possible? And for some people, that is incredibly important. It might be, like it is for my little sister, a religious value, or a moral value, spiritual consideration. For other people, it's about the quality of life, what they're able to do with the time that they have remaining. So a lot of people will, for example, terminal cancer, they may make this decision that they want to have a higher quality of life, and they're willing to give up some of the potential for quantity of life in order to be able to connect with their family and to be in less pain and not have to go through additional invasive treatments. And so this is a question that has to be considered by an individual, for an individual, and considering their specific circumstances. Because I can say what is true for me right now, and that right in this moment, quantity of life is probably means a bigger deal to me right now over the quality of my life. But that's because it's not really a question, right? I don't have a question right now about the quality of my life over the quantity of my life. There's nothing that's really pressing on me to make that decision. So right now, I want both. But when I get to a point where I may have to make a choice between one or the other, I may have to think about these questions again. What am I most worried about? Is it that I'm in pain, or is it that I'm able to see my family? Is it that I'm able to hold a conversation? Is it that I am living the life that I think I need to, or I'm dying in a way that I think I need to, for whatever purpose I have here on earth? So these are very individual questions, but they're important reflection. And when we can start to answer these questions, even if we can't think of every scenario, we can give people really good guidance about what the expectation is. I will generally, because I I'm not in a medical crisis right now. I don't, other than the pain syndromes that I told you about, my health is relatively stable. And I don't have chronic health issues at the moment that are going to impact the quality of my life beyond the occasional migraine. But what I do know is that in my medical history, that dementia is really common in my family. 3 of my 4 grandparents died with some sort of neurological or cognitive impairment. And like looking ahead and being able to tell my husband and my best friend right now, what's most important to me is being able to have deep, meaningful conversations and engage with my friends and my family. And that's more important to me than having zero pain. So what I worry about is when I'm no longer able to have those meaningful conversations. Well, then how am I going to respond to pain? How might my pain management needs change? And so that's where I'm able to have these conversations of, I know that this is likely to happen. I'm likely to develop dementia. I have the genes for it. It is likely for me. What I want you to know is if I'm still able to have a meaningful conversation with you, I don't care if it's in the past. I don't care if it means, that it's just kind of a silly conversation. But if I'm truly engaged with you in a conversation, that's really more important to me than whether or not I have zero pain. But if I ever get to the point where you cannot engage in a meaningful conversation with me, or I can't connect with my friends and my family in a meaningful way, pain management is going to become a much bigger deal. And I'm going to want everything done to try to get that pain level to as close to zero as possible.
I have a question.
Yes.
Goes back a little bit. Can my POA for healthcare, if I'm confused, if I don't understand the question, if I feel overwhelmed, if I need clarification, and she knows, of course, these issues about me, can she speak for me in that case?
Yes. If your power of attorney has been activated. So this brings up another piece of the power of attorney. And generally, though, if you have an agent listed, even if they're not activated, your providers will defer to them if there's potential for confusion. But activation in the state of Wisconsin generally requires 2 doctors or a doctor and an advanced clinician. That would be a nurse practitioner or physician's assistant, psychologist, to say that you are no longer able to make medical decisions on your own. You are never completely removed from the conversation, and so you should always know that you have the right to be involved in conversations around your healthcare. But anytime you feel, you're not able to, or you need that additional support, a power of attorney for healthcare document can help identify who is the best person to help you understand what's going on, whether that's through speaking on your behalf or helping to reword conversations or advocating for you based on their knowledge and their history with you. But yes, that is part of their role. Does that answer your question?
I think so. They can help me to understand and so forth.
Mm-hmm.
Being activated.
Yes. Mm-hmm.
Thank you.
You're welcome. Then the last section that is available for you to fill in, and you don't have to, but I encourage people to, and this is where you can start to free text. These are things that are really important to me. And these are some sample statements that people have provided. It is not a requirement for them to be in here in your legal document, but it can give guidance. So I want doctors to do everything they think might help me, but if I am very sick and have little hope of getting better, I do not want to stay on life support. So that has been something that I've seen in the sample provisions or in the additional provisions section. I would prefer to die at home with hospice services to support my caregivers. Generally, people will ask the question, well, if I give my agent the right to make decisions to place me in a skilled nursing facility, does that mean that I'm telling them I want to live in a nursing facility at the end of my life? And the answer is no, that's not what that's saying. What that's saying is that if that decision needs to be made, your agent can make that for you. But it is not saying that they are required to place you in a nursing home or that that's what you want. In the provisions section, you can clarify what you mean by that. And I have had a lot of people say, my preference is to live out the rest of my life at home or to die at home. And I would like every measure taken to accomplish that. If it is not able, only if it is not able, do I want what I consider a skilled nursing placement. And these are not exhaustive by any means. I have seen these laid out really well. I've seen other things that are a little bit more specific. I've had one person list all of the medications, pain medications that she'd be willing to have at the end of life because she knew that her daughter who was her agent had some fear around using opioids. And so she wanted it to be really clear that if she was in significant pain, she wanted to receive opioids at end of life. And so she listed out all the medication. I've had another person who said, I always have cold feet. I hate having cold feet and I don't want to have cold feet when I'm dying. So please ensure that I'm wearing my favorite socks if I am in my last days to hours of life. I've had someone else who said, it's really important to me, you can place me wherever you want. I don't mind where I am, but I need, or not need, but I want to have a beer every night, or I want to have an old fashioned every night because this is Wisconsin. And so that was put into their advanced directive. So this is really, the sky's really the limit. There's not a guarantee that every special provision that you put in or clarification that you put in will be able to be honored. But if it's in there, it is much more likely to. And for example, in the case of the people that have, one was a gentleman, one was a lady, who had wanted either a beer or an old fashioned, they were both in a skilled nursing facility, and we were able to put it in as a medical order for them. So they had prescribed one beer, the gentleman had prescribed one beer per day in order to meet his wish of having one beer per day.
Dina, if I could jump in here just a second. Some
Yeah.
of these are very specific and easy to understand, but others, I'm looking at number 3 here, and I am not expected to return to full independent functional capacity. There'd be a lot of people getting the switches turned off if that were strictly interpreted, right? I mean, so how do you get somebody to go from the idea they have to something that's specific and well understood?
So this is an example that I took from one that was written by a lawyer. It's not necessarily the wording I would use. The wording that I would use in this one, if I'm not expected to return to my previous condition or my previous level of functioning might be a way I would word that. This, I would encourage there just to be a lot of conversation. The nice thing about our advanced directive laws in the state of Wisconsin is that anything that we put in our advanced directive is that there's an obligation that we try, that providers and agents do their best to acknowledge and accept. The other thing is that any conversations that we have around advanced care planning with our providers, there's an expectation that that's put into our medical record. So this is one where I would encourage, what do you mean by that? Tell me what you mean, full independent functional capacity. Does this mean that you want to be able to be up, walking, in your own home, able to take care of yourself? Or does this mean that you would want to be able to sit up, express your needs, and breathe independently? So where is the line here? And I would encourage people to write it out directly. So does this mean that you want, if I'm not expected to return to what I was prior to my coma, then I would want life-saving treatment turned off. That's a very strict interpretation of it. But that is what some people mean. They're like, no, this is how I want to live my life. And if I'm not able to live like this, then turn off life support. Other people, it might be, if I'm not able to return to some sense of normalcy where I'm able to move around and able to engage with my family. And it's okay if I require assistance. And so then I would encourage them to write that. Does that answer your question, Mike? It's really all about the conversation.
Yeah, it does. That's good. And yeah, thank you. That's very helpful.
Yeah. The final, go ahead, Carol.
It's Carol again. Doesn't a DNR answer some of those issues?
It does. But not everyone is ready to complete a DNR when they complete in a power of attorney for healthcare.
Okay.
So a DNR can answer it, but not everyone has one right away.
Okay. Thank you.
Mm-hmm. So the next piece, or in order to make an advanced directive or a care power of attorney for healthcare legal, it needs to be witnessed, and it has to be witnessed in the state of Wisconsin by 2 people. They have to be over the age of 18 years or older, and they have to be cognitively aware. That cognitively aware piece, you've probably noticed I put it in twice, and that's because of my own personal history. Sometimes people will just kind of grab anyone that they know, and my older sister is a wonderful human being. I absolutely adore her, but she's got the mentality, and she's been assessed at having the mentality of about a 12 to 15-year-old, kind of depending. So she's 18 years or older. She's older than me, but she is not cognitively aware. And so it would be inappropriate to use her as a witness. Additionally, they have to be, they cannot be related to you. They cannot be someone named as an agent in the document, and they cannot be entitled to any part of your estate. They also cannot be a healthcare provider or an employee, with the exception of a chaplain or a social worker. And because social workers are included in that, that's why I'm able to give this presentation. Every clinic, every hospital will have a social worker on staff that can answer questions and be a witness, but you don't need to have a social worker. You don't need it to be notarized. It can just be 2 two people. It can be two neighbors, it can be two of your friends. It just can't be two people that are related to you or somehow want to benefit from you. Advanced care planning, though, is not a one-time thing. It is an ongoing process. It is an ongoing dialogue. And while completing an advanced directive is an important piece of it, it is not the only piece of it. Those reflection questions, those conversation prompts that I provided throughout, and I'll send the slides over to Mike, so if anyone wants them, can reach out to Mike and Mike will give them to you. But this is all part of an ongoing conversation because things change. What is true for me today at 37 isn't going to be what's true for me when I'm 87, and I know that. And I would want to be keeping up with things as things change. Other things to keep in mind when you complete your advanced directive, when you complete the document itself, you want to be sure that you are sharing the wealth of information. Make sure that your agent is aware, hey, this is what I want. This is why I've named you. It's not a requirement. You don't have to tell a surrogate decision maker that you've named them as a surrogate decision maker. It does make it easier for them, though, if they know to expect it. Reviewing is part of this. So you want to review your advanced directives. And these are, according to the American Bar Association, these are the 6 times in our life that we should review our healthcare wishes. And that's at least once a decade. They say when you start a new decade of your life, that's a decade is it's a relative term. About every 10 years or so, it is recommended because a lot can change in 10 years. Anytime you've experienced the loss of a loved one, because this is often a time that our things in our life may change, or it may give us some additional things that we want to consider, additional information about ourselves. So I encourage then as well, when you divorce or you've had any sort of family change, it's important to review your healthcare wishes. One of the reasons that divorce is called out, though, is in the state of Wisconsin, if you've named a spouse as your agent and you complete a new, or if you've named a spouse as your agent and you get divorced, then your power of attorney for healthcare is automatically void. There's no even process around it. It's just, as soon as the divorce papers are signed, any power of attorney that has named that individual is also void. So this has happened to people where they thought they had everything in place because their ex-husband or ex-wife was their surrogate decision maker, but come to find out that's didn't work the way they wanted it to. You can always have an ex-spouse, you just have to create a new one. Whenever you have a new diagnosis, especially if it's a serious health condition, taking time to consider what is going on, have my wishes changed now that I'm aware that this is a health consideration for me. Anytime we've had a significant decline in our existing health conditions, and anytime we change or move is another time I encourage people to consider your wishes and do I have the right people listed? When you've completed advanced directive, especially a power of attorney for healthcare, I encourage you to keep a copy for yourself, give a copy to your surrogate decision makers, give a copy to your doctor and hospital systems. If you give a copy to your doctor, they will put it into your medical record, then it should be accessible by other medical professionals if they need it. But I also encourage people to, if you know you're going to be traveling, carrying a copy with you, especially if you do have health conditions that you want people to be aware of. Just, it can save some time in the event of an emergency. There are a lot of really great resources on how to answer the questions, what are some additional supports that you might want to consider. So there's some online guides. Some people really like them. There's a consumer tool guide from the American Bar Association, and then there's also additional forums. And there's some fun ways to consider. There's a Hello. It's a conversation game through Common Practice, and it kind of takes you through and encourages open communication about wishes with loved ones. Any questions for me?
I have a question. When you're considering changes and updating, as far as revocation, getting rid of prior power of attorneys for healthcare, you just to shred them.
Yeah.
Yeah.
So when you are updating a power of attorney for healthcare, I encourage, so as soon as you create a new one, your old one is no longer considered active or legal, but to make sure that no one has a copy of it, I encourage just handing out the new one to your providers, to your agents, keeping a copy for yourself. You can shred your old one as well. That automatically invalidates the power of attorney. So if you tear it up, that invalidates it. And in response to Jim and Steve's questions, I will be sending the slides over to Mike so that Mike can share them. I'll put my contact information in the chat as well, so you can reach out to me directly. And I can send them to you that way. I can't post them on the Grace offering. I don't have the legal authority or the power within the organization to do that. So that's a great idea. I'll have to check with marketing if that's something we can add in the future.
Dina, I'm wondering about costs. Would people typically have some costs associated with creating these documents?
No, so the power of attorney for healthcare, unless you go through a lawyer, can be completed for free. So it is simply printing off the Wisconsin form and finding a couple of witnesses that aren't related to you and aren't your healthcare providers. And it's the cost of time. That's the cost.
I have a question. My name's Joanne. I'm sorry I joined so late. I completely forgot about it. So I'm glad I got a little bit in at the end here, but I will be traveling, actually moving soon to California. And I know the first thing that will happen when I arrive is my daughter that lives there is going to insist that I go get all this done because I don't have my anything planned, my advanced directives. So in traveling there, heaven forbid there's some kind of an accident, would it be legal for me to at least put in writing, I wish for this daughter to be my power of attorney. I wish for this daughter to be my healthcare directive. Would that hold any weight?
Putting it in writing is not a bad idea, but there's no guarantee. There's no legal requirement for someone to follow it.
Oh, okay.
But if you have it in writing, then they know what your wishes are, and that can be advocated for.
Okay, well, of course, I would speak to each daughter that I would, I'm sure that they would go along with it, but having it in writing, I didn't know how important that would be. I'll certainly do that. Thank you.
You're welcome.
More questions? Go ahead.
Oh, I was just going to add, the reason my daughter will be so insistent is because she just went through this about 6 months ago with her father, who had a fall and a brain injury, and his last wishes were very vague. I want to eat and be able to have a conversation with people I love. And then she was left with 2 weeks on life support, making the decision that, you know, it would have been very helpful if he had been a lot more specific on those details. Thank you.
That is so hard to be a decision maker and not have that guidance. So, yeah, thank you for thinking ahead of like that, Joanne. I put a link in the chat to the state form where you can print it off.
Yeah, that's
can
very
also-
convenient.
Yes.
So that's really great. Any other questions? We've got Dina here. If you have questions, please lob them her way. If not, I'd just like to thank you, Dina. It's been a terrific information-filled session. It's really wonderful. Last chance, everyone. Okay, let's call it a day.
Thanks, Dina.
Thank you
Thank
so
you
much,
all.
Dina.